All right, what's going on, guys? Welcome back to episode 9 of Sips and Tips, where I sip some coffee, give you guys some tips, answer your questions. We are moving along. I set out the goal of doing 10 episodes, so we're one away from hitting the goal of 10 full episodes of the series. I've been having a lot of fun. I've been appreciating all the questions. If you guys want to submit your questions, you can comment them in the live video. You can submit them to us via DM, and ideally we get to the point where we have some people come on the live show and actually ask some questions. Haven't had that yet, but I'm looking forward to the day that happens. Before we dive into the episode today, guys, I just want to let you know that we're trying to really build up our YouTube channel. So I dropped the link in the comments of this video. I really want to try to get our YouTube channel up to 500 subscribers this year. We are moving. We're at 233. Our little benchmark is to get to 250. So if you guys want to check out our YouTube channel, head over there, subscribe to the channel. I put the replays of all the Sips and Tips episodes there so you can catch all the answers if you don't stick around for the whole live. You can also check out some of the other videos that we have going on there. We're currently doing a Road to 50K series, highlighting Will's journey to his first ultra marathon. Been having a lot of fun with that. So if you guys are interested in that type of content, head over to our YouTube channel and check it out. So today, don't have a ton of questions. So if you guys are in the chat, make sure you throw a question there, but I am going to rant a little bit on a thought. And this is kind of what happens a lot of times, is there's just some consistent patterns that, we see here at the clinic, whether it's amongst like our clinical team, the conversations that we're having, or it's me just getting a lot of the same kind of thoughts coming from some of the sessions that, I'm doing with my clients. But a little while back, I guess you call threading it. I posted a thread, and I want to share that with you and then kind of break it down, because it's been something that's been on my mind a lot the last, month. And I really think it's something that I want to continue to get out there, and hopefully we can see kind of a shift in how we view healthcare from this perspective. So the thread that I put out was: injury can be the perfect catalyst for taking control of your health, yet our system is designed to do the opposite. It instills fear and removes an individual's sense of control by placing it on external factors such as medicine, modalities, or something like age. This is a disservice to our society. Healthcare providers, we need to take responsibility for breaking out of this cycle. Consumers, we need you to demand more from your providers and be willing to invest in those who are driving change. So this was a tweet that I put out when I was just thinking about a lot of stuff, as I often do, probably after I drank too much coffee. And it is something that I'm really passionate about, and I want to kind of break it down almost line by line and kind of share a little bit of a deeper thought into like what was going through my mind when I tweeted this out. So injury can be a perfect catalyst for taking control of your health. This is something that has been in my mind a lot. I've talked a lot about on this show, specifically this line, because it's been happening a lot lately here, and I've seen it in my career, especially since we opened the movement in 2020, is that people come into rehab because of pain and injury, but it is a great opportunity for them to actually change their health and take control of it. And why I say this is a lot of time I see clients come in here who maybe were fit before. Maybe they were training a lot before. Maybe they were, really into it when they were in university or younger. And then, they get into life, they get into work, they get into kids, they don't train, they start to become a lot unhealthier. And then they have an injury, probably due to the fact that their capacity is really low because they haven't been training. And so injury can be a perfect catalyst to actually take control of their health and reignite that passion for health, fitness, strength training, whatever it is that they maybe used to do. And we know that if we can have people actually focus on their nutrition, their health, the consistent habits of exercise, that is going to absolutely make them healthier, and more than likely going to help them with their injury and also reduce the risk of them having injuries in the future. And I think we underestimate the opportunity that we have as physiotherapists to actually have an impact on people's health, not just reducing their pain. And I think that's a big part of what we market out not us specifically, the movement, but the profession markets out that we are here to just reduce your pain. And that is one factor that happens, but I think it's bigger than that. And I think there's plenty more opportunity that we can have to actually impact people's health. And so that's been a line that's been in my head a lot lately. And I think it's super important to think about whether you're a clinician or even just a consumer of healthcare. Then I went on to say, like, yet our system is designed to do the opposite. It instills fear, removes an individual's sense of control by placing it on the external factors such as medicine, modalities, or age. I really think this happens a lot, and it's unfortunate. Our healthcare system in general tends to instill a lot of fear in people. If you have knee pain or if you have knee OA, you can't run for the rest of your life. If you have back pain or you have back degeneration, you can't lift heavy for the rest of your life. It's very fear-based. And there are so many people that come through our doors that have an immense amount of fear of what their bodies can do because they've been told by someone that they're fragile. And then that is further enhanced by taking the external control away from the individual and being like, well, we can help you reduce your pain by taking this medication or by using this type of modality, whatever modality you want to put in there, ultrasound, dry needling, even exercise, or we blame it on age. Oh, I'm just too old. I can't get stronger, or, once I hit 30, it's all downhill, or, you hear even healthcare professionals labeling age as a reason why you can't do things. And I think that is very much a disservice to our society, which is like the next line that I went on to say is this is a disservice to our society. And I truly do think it is. And I think unfortunately sometimes, we perpetuate those things as healthcare professionals, and we shouldn't be doing that. And I think realizing that that is happening, and I don't think that this is with any intent a lot of the time, but it's just not paying attention to things like our language and how we speak to people and the environments that we create and the type of interventions that we use. A lot of them are fostering fear and or putting the control into someone else's hands versus the opposite, where we put the locus of control within the hands of the individual and we empower them and we coach them to help themselves, reduce their discomfort and take control of their health and get stronger and get back to the things that they want to do. That is what we should be doing, versus I think a lot of times the opposite happens. And so the following line was, healthcare providers, we need to take responsibility for breaking out of this cycle. And I truly think it ends up always falling on us. And that's how I've always looked at it as an individual, as a business, building the movement is like, it's our responsibility to break and change this cycle. And we have to take ownership over that. And that's not to say that everything that was done before that is bad or negative. I actually think it's the completely opposite. I think the profession has done so many great things, but like everything, we develop, we grow, and we realize some of the things that maybe we did before that weren't necessarily as productive as we once thought. We have to move away from that. And I think that is where we struggle. We struggle to break out of this cycle. And I'm speaking from the perspective of being a healthcare professional and being in the industry. I see a lot of other people talk about how things need to change, how they're burnt out, how the models aren't working, but yet we just put ourselves back into those models and we do the same things over and over again, and we don't break out of this cycle. And a lot of that, I think, has to do with a bit of fear and uncertainty of stepping outside of what has always been done and embracing and developing that into something new that we can continue to grow year over year over year as new information comes out and as we adapt our skill set. But there's this comfort in doing that same old thing because it's what clients expect, it's what the public expects, it's what we are coached to do in physio school and healthcare providers, and they're like, whether it's chiro and everything else, they're all educated on this way of doing things. So when you step out and now you're trying to change the way that you're doing that, it's very scary. But I think it's a responsibility from us as healthcare professionals, and that's how I've always looked at it, and that's why we do what we do at the movement. That's why we do what we do with our mentorship to help instill some of the stuff in younger clinicians. That's why we do what we do in the community and how we communicate communicate and market on social media, on our blogs, on podcasts. Like, there's so many opportunities to communicate this change that I think is very much needed, both for the profession and also for the public or the consumer, which is why I went on to say, consumers, you need to demand more from your providers and be willing to invest in those who are driving change. And what I mean by that is that if you feel like this isn't something that, is helping you, or isn't the way that you have learned on your own that might be helpful, and you're going to someone or you're going to a healthcare provider and that's not happening, it's like you can demand more from that, or you can go and search out and try to find someone who does. And when you do find those people that are doing it the way that you want to consume, then you need to invest in those people and support those people, because the only way that we start to see change is if we start to get both the public and the profession on the same page and investing in each other. And I think that is a very important relationship that needs to be developed in order to foster actual change. And I think it's obvious that we need change in the healthcare profession in general, all facets of it. And so how do we enact that? I think it's taking responsibility, both the individual who is a professional, but also the public and the consumer, to take responsibility for demanding more and investing in those people that they know are doing it the way that they see as valuable, because that will then encourage more professionals to invest and grow and change the way that they're doing things, to be able to support a consumer that is demanding something. And I think it's a very integrated relationship between the two, and that's why, from my perspective, I think we can't talk about this stuff enough, and it's why I come on this live and I share our approach and I answer questions and I talk about these things. That's why we post on social media. That's why we have podcasts. That's why we use the internet, because there's a lot of opportunity for us to connect and build relationships with consumers and share with them how we're trying to approach healthcare, which, if they align with that, it's then their responsibility to go and find those people and invest in those people and help that movement grow. And I really do think that's how change occurs. I know this is a massive topic and I'm not going to solve all the healthcare problems in one go, but I always look at it from the individual level, and my responsibility as a professional, a healthcare professional, as well as a business owner in the healthcare profession, is how do we keep improving? How do we keep growing? How do we keep actually providing value that is helping people change? And I think that is the most important thing. And that's what kicked off this whole kind of tweet, was injury can be the perfect catalyst for taking control of your health. And I truly believe that. And I think our value as healthcare professionals goes far beyond just helping someone reduce their pain. It helps them implement exercise. It helps them take control of their health. It helps them implement behaviors that are positive. It helps them build sustainable routines that they can consistently do over long periods of time, so that they can be healthier for themselves, for their families, for the goals that they want to accomplish. And I think that is a super valuable position to sit in. And I think healthcare professionals and physiotherapists specifically have a great opportunity to do that if we start to change the way that we approach our value and move away from it being, I can do something to someone to reduce their pain, versus I can get alongside someone, coach them, and create an environment that is empowering and that fosters that type of change. So, not a lot of questions today, but this has been on my mind, and I just wanted to share it with you guys. A little bit of a rant, so to speak, but that's what happens sometimes when you sip too much coffee. But I hope that resonated with you guys. If you have any questions about that specific thought, feel free to send me a DM. And make sure you check out the YouTube channel if you want to watch back this conversation, any of the other episodes of Sips and Tips. On the previous episodes, I answered a lot more questions, but today I didn't have too many new questions, so I figured I'd share a little thought with you guys. So if you have questions around injury, rehab, performance, and anything along those lines, send me a DM and I will answer it on the show. We will be back next Thursday for episode 10 of Sips and Tips, 9 a.m. Eastern Standard Time. Make sure you guys check out the YouTube channel, subscribe. We want to get to 500 subscribers. We're getting there. We're almost halfway. Our next mini milestone is to get to 250. I think as of today, we have 233 subscribers. So check out our YouTube channel, subscribe, come hang out. And yeah, I hope you guys have a great day. We'll see you next week. Stay caffeinated. Peace.